Morning. Thank you. This is the Governor's Healthcare Economic Development Summit. So for the last 7 years now, we've been talking about healthcare as an economic driver in the state of Mississippi. So today we'll talk about not only healthcare and how we can make it better in the state of Mississippi, but how you can have access to healthcare, which is so critically important. 99 acute care hospitals in the state of Mississippi, employing over 60,000 Mississippians. It is important that we continue to expand healthcare all across the state of Mississippi, and this is a remarkable opportunity for us to do just that.
It's really designed to talk about the role healthcare plays in our economy here in Mississippi, all of the things that are happening, from not only a healthy workforce, but the ability to have health care offered for our citizens, but really how businesses support the healthcare industry and how it helps grow our economy.
The Mississippi Healthcare Solutions Institute is designed to be an economic driver for the state of Mississippi through the use of healthcare. And so we're trying to have organizations like hospitals and physician organizations, clinics, nurses, nurse practitioners, physician's assistants. How do we bring those folks together to bring our economy in the state of Mississippi up, and to try to find new ideas and collaborate with other facilities like the Cleveland Clinic or the Mayo Clinic and places like that, other healthcare companies? How do we bring those jobs to Mississippi?
This all began when MEC's 2011 Blueprint Mississippi report listed as one of its top priorities promoting healthcare as an economic driver. Governor Bryan immediately jumped on this and said, look, we've got to take a look at it. So we then did a second report that was basically entitled Blueprint Mississippi, Healthcare as an Economic Driver. Real simple title to a very complex issue. And in it, it listed a number of tactics. As a result of it, the Healthcare Solutions Institute was formed, which is part of one of our task force through the MEC Blueprint program, and actually started looking at how do we implement these tactics, how do we create more incentives to make investments that support healthcare, how do we look at getting doctors, licensures for doctors, an easier process, how do we take into advantage of using clusters and corridors for medical areas to really be successful in the state. And I think as a result of that, we've seen great success. We've seen things like the Healthcare Zone Acts pass. We've seen things like the creation of the medical city down on the coast, and the increase in the ability to have more students become doctors. So all of those things are a big part of the equation that are continuing to move us forward.
Everyone always talks about, you got terrible health care, you got terrible health care ratings with your population, but a very wise man once told me it's not just health care, it's access to health care. And as I looked across the state of Mississippi, I realized what a challenge it was for access. So we decided, working with MDA, to look at health care as an economic driver, just like the automobile industry. If every time we've got a physician, we would say, that what one physician can create jobs, the multiplier effect of that one doctor in the community can be $1.5 to $2 million. And so MDA has been helping along the way, making sure that we look at it as the aerospace industry, as the manufacturing industry in the state of Mississippi, as tourism, and then there's health care. 99 different acute care hospitals in the state of Mississippi, employing 60,000 Mississippians. I'm going to show you in a minute just what an economic impact that is. Our universities, not just the University of Mississippi, UMMC, which has a pretty nice new medical school up there, but our community colleges, which are now and have been working on, I think, some of the most talented nurses in America, trying to keep them here in the state of Mississippi. Scott, thank you for Blueprint Mississippi. In 2011 in December, we went to Houston, Texas, met Dr. Nawardi, and we saw something remarkable, a medical city, and I just fell in love with it. So I'm going to start with my PowerPoint before I talk over every one of them and give you a little idea of how proud we are of what we have accomplished, much of which since 2011, when Blueprint Mississippi came out and told us what we could do.
No longer can we have a physician-dominated, mano-a-mano kind of attack on a disease. It takes a tremendous amount of individuals to create the team, and we need to rely on our nurses, nurse practitioners, PAs, pharmacists, diabetes educators, diabetologists, and coordinate that by linking these centers of excellence, which we're trying to do within Dory and with our partners and with other industrial-based components, particularly something, again, that Governor Bryant highlighted, and I don't think he highlighted it enough. Sorry, Governor. And that is what Mississippi has done with their distance health programs, the telemedicine ventures. And something that needs to be focused on is how to utilize that, how to expand that, how to get broadband everywhere so we can use the highest level of technology to get access to the patient so that we can see a diabetic patient not once a month, not once a year. We can see them every week, particularly if we utilize our nurse practitioners, our nurses, our pharmacists, in addition to the physicians. Now, why is all this necessary? Simple. 23 million Americans have diabetes. 85 million have prediabetes. If you look at deaths, 80,000 directly related to diabetes, and 200,000 have diabetes as a component element to it. 7% of non-Hispanic whites have it, 15% of American Indians have it, and overall, if you include prediabetes, it's up to about 20%. And if you look at the total cost, $327 billion. Of that, some $80 billion just due to lost days of work and an inability to perform. Now, obesity, being overweight, technically being obese, according to NIH criteria, 2 out of 3 adult Americans, including me. I struggle a little bit. So the intimacy of obesity and diabetes as it relates to the overall difficulties we have is huge, and we must figure that out. And so if we look at where we need to be going, it is to change the structure. We need to declare war, a war that we can win, not like a lot of wars that we are currently dealing with, but a war on diabetes and obesity, just like we have a war on opioids now. And we need to create a different formation of teamwork with nurses and pharmacists and dietitians, as I said, and we need to rely on new technology to capitalize on the new workforce that can only come out through education, organization, and teamwork.
There's $3 trillion annually spent in healthcare. That's 18% of our gross domestic product. $1 trillion of that is the medical payments between health insurers and health systems. Traditionally, that's been based off of fee-for-service. Patient goes in, is seen, the provider is reimbursed. There's not necessarily, though they're getting the right level of care. I have many great physicians and many health systems that I work with in this state and in Louisiana and Alabama, but there's nothing in that model that actually incents outcome or changing outcome or increasing quality. Second item under cost inflation is chronic condition. We've been talking about it, obesity, diabetes. We have type 2 diabetes, hypertension, heart disease, prevalent issues in the state of Mississippi, which contribute to about 75% of our costs. And then the last thing under cost inflation really is still gap in care in patient experience, non-integrated systems, or lack of collaboration. When I think about the consumers and their thirst for digital health, I think about the health technologies, I think about telemedicine, I think about the need for health apps on your iPhones, I think about virtual visits. I also think about all of the different sets of electronic health records coming from data. And then you also look at consumers expect a lot, and they should get a lot because it is their health. And they certainly want to live long, as do I. So what are you going to do? If we don't address those two issues, we're going to continue to have an epidemic. We're going to continue to have a disjointed system, transactional, reactive, not preventative. So in my opinion, there is truly a reason to get up every morning, and it is to address those common issues. And that's what motivates me. It motivates me to interact. And so I thought about what I would share on what the solution is. So I kind of shared some of the things that really are driving that undercurrent. I thought about collaboration within the industry. And I thought about levels of collaboration. When we don't have collaboration, I think to traditional conversation between myself and so many in this room, but also from a health system perspective, it's more about rates, more about transactional detail, and certainly there's a lot to be had there. But when there's just a little bit of collaboration amongst us, we're able to come together and put things on the table like performance-based contracts, which is essentially you're looking at a few quality metrics, and there's going to be a portion of incentives, extra dollars that can be identified for a health system between the insurance carrier and the employer can win on that too. Bundled payments is another space as it relates to looking at episodic care. I look at spine and joint, and you look at centers of excellence in the state of Mississippi, and you identify an area, which we have a few, where they have the ability for all of the tests, the diagnostics, the surgeries, and the rehab. And then we identify a bundled payment for that. We've seen 40% savings in spine and joint in the last 2 years in the state of Mississippi because of bundled payments.
At the state level, we're going to need qualified faculty to do all of this, and we're unable to pay faculty what they can make in practice. That's a real issue. We struggle to attract and retain the brightest and the best. We also know that restoration of our loan scholarships for nursing would help us keep our nurses here. We have physician and dental rural scholars programs. If we could expand those to include nurse practitioners, we could probably have the desired effect of improving healthcare access, and certainly I think the economy of rural Mississippi. At the national level, we need funding for graduate nursing education, such as that's provided for our graduate medical education. And so I think that needs to be reconsidered with some, there have been large demonstration projects, but not smaller ones in different areas of the country. So to reiterate, we need to look at our best evidence, our workforce evidence and other evidence. The health of Mississippians must be in the mix as we make our decisions about workforce readiness. And if we don't all come together soon, we're going to miss the opportunity to put Mississippi on the map as the state with the most improved health outcomes rather than the state with the worst health outcomes. So workforce readiness for the largest number of healthcare providers in the state, nursing, means more than just cranking out more numbers. It means putting the right mix of engaged practitioners and leaders out into our communities and helping to shape the best health and economic policies for our state. Thank you. If we are going to improve the health of Mississippians, we're going to have to do it together. We are going to have to work together as healthcare professionals with communities to help design better communities, to help them actually develop ways to take care of themselves, and it's going to take all of us. Nurses are the greatest number of providers in the state, so we actually have a better opportunity to do that. But working with all of the other healthcare professionals is really going to be the way to go. And the communities can take care of themselves with the assistance.
Well, my message is you got to start swimming or you're going to sink like a rock, like the song line goes, and the point being we have to change, and we have to change the way we do healthcare delivery. And for three critical things that we're focused on today, the obesity epidemic, the diabetes epidemic, and the opioid crisis that we have, we need to marshal a team of teams. We need to have an interactive healthcare approach that utilizes our nursing colleagues, physicians, nurse practitioners, pharmacists, and the whole public health cadre of healthcare providers that we have. That's the key message. We have to change, and we have to start pulling together as a team.
In the state of Mississippi, a tremendous amount of energy and focus of collaboration between the healthcare systems, our health insurance providers, and many business group on health. And so the more that we can collaborate as an industry to combat obesity, prevent diabetes, and discussing topics like we did today at this summit, we can accomplish some great results.
We have 11,500 employees on the Mississippi Gulf Coast. So we're not only building great ships, we're helping to build a healthy workforce, and that requires a lot of the organization. So the cornerstone of that is our human capital strategy as an organization. I mean, the building of ships is extremely labor intensive, and it's not an easy job, and it's hot in the summer, it's cold in the winter, and you want individuals who are truly kind of industrial athletes who are really building ships. So what do we need to do as an organization to help achieve that? A few years ago, our organization decided to make an investment, and I truly will say that it's an investment, because you're making an investment in putting in a family health center that you may not see that return for years. And so the organization made a conscious decision to put in a family health center. The family health center is located about 8 minutes from the shipyard. If you're on our health care plans, you and your dependents are eligible to participate, but you can get your physicals, you can get your health care treatment. It has a CVS on site. You can get blood work drawn, x-rays, diabetic counselors, wellness coaches. That's all part of our family health center. This year, we actually added vision services to it. So there's a vision center at our family health center. About 36% of our workforce actively participates in the family health center. If you choose to use the family health center, you can still go to any doctor in the community that you want to, but there's a discount if you decide to use our family health center. We've been successful in doing that, and we're very pleased with the participation that we have from our workforce, but our family health center is the cornerstone of our health initiatives in our organization.
What kind of results have you seen?
So, like I said, 36% participate. We've seen a decrease in emergency room usage. We've seen decreases in individuals with some diabetic items, but we've been very happy with the success so far.
Murray and I started the Mississippi Business Group in 2014. Now we have, about 60 companies. And it's a voice for employers to say, we want a seat at the table as we talk about these changes. The old models of healthcare, they're just not going to work. We're looking for, different payment systems and accountability, but there's a lot of cool stuff going on. As I have worked with people like Evan Dillard from Forest General and Chris Anderson from Baptist, Stephen Dobbs from Merritt Hospital, Lester Diamond and Deidre Bell from St. Dominic's, and Shane Spees from North Mississippi Medical Center. Those are CEOs and executives, CFOs, that are sitting down in rooms and listening to how do we make this better. I think a lot of employers thought the ACA, Obamacare, or whatever you want to call it, I think they thought that was going to be our answer. Defined benefit plans. How many of y'all still have a defined benefit plan? Most companies don't. We do at Southern Farm. We're one of the few. But they did away with it, and from a cost standpoint, they just turned the DC, defined contribution 401k, type plans over, so the cost went way down. They got out of the business mostly. With healthcare, employers thought we'd just hand it off to the government, let them run it. I always say, if you like the $8 billion the post office lost last year, you're going to love what the government's going to do with healthcare. So, the government is not going to solve those problems. To me, the best thing that came out of the ACA and Obamacare is it's got employers and hospitals and doctors working together in events like this through a collaboration of trying to make things better. That in order to solve the healthcare crisis, which the number one cause of bankruptcy in America is healthcare cost, is a collaboration between the hospitals and doctors and employers are the things that are going to solve and improve our healthcare, both cost and quality in this country.
How serious is that problem in Mississippi?
Oh, I think it's very serious, especially as you get in the rural areas. You got all the rural hospitals closing down. They're having a hard time getting practitioners, nurses, doctors. So they have a huge problem. And in the cities like Jackson, it's hard to fill a lot of the positions that they need in the medical community. So it's a very serious problem in Mississippi.
We started actually bringing care to the employees. And what we did that with through what we call health fairs. Over the years, that sort of has transpired into where we actually go out, and we go to about 95 locations this coming year, and we'll actually do a finger stick so people can get their results right there, right then. So that access point is becoming a little bit closer to them, and we're hoping to be able to do some more stuff with the incentive programs. A couple of years ago, actually I guess it was 2009, we started tying you going to the doctor, getting your Healthy You visit or your wellness visit. We also tie that to the health risk assessments that a lot of people take nowadays. If you're not doing anything with that data, then it's a waste of your time. But what we do is we take that data back, and that's what we say, okay, well, what else can we do with our health plan? So over the last couple of years, some of the other plan design changes that we've made in our benefit plans was when people come in, if they want to participate in a diabetes education program, I'm going to give you free diabetic supplies. I'm going to give you a free glucose monitor to where, guess what? Again, I'm removing those barriers. So we always wanted to try to figure out how do we get that better engagement. And what we do is we keep looking at what are the barriers. So over time, we continue to make these changes. And so what we have seen, especially here in the last 5 years, and to Billy's, what he was just talking about is our costs have been somewhere in the neighborhood of 1 to 2% going up versus the national averages of 5, 6, and 7% over the years. And we've been able to sometimes keep our medical costs flat. And I'm here to tell you, in an economy that in the last several years, when you talk, and if you go out and look at the exchange today and you see some of the rates that people are paying for healthcare, you're going, how are you doing that? And I think it does come down to that design. And the employers are the ones that can actually put this into place.
Employers here in the state of Mississippi are working toward a healthier Mississippi. We are looking to see what type of collaborations that we can come up with, we can partner with to try to move that health needle that all of us here in the state of Mississippi want to do, and that is to have a healthier workforce, because we know if we have a healthier workforce, we're going to have a healthier economy, because that will help our bottom line.
I was in Ohio 3 weeks ago doing due diligence for a large bank coming out of New York and Tokyo, looking for a large IT center. And this community in Ohio was in the top 4. We were conducting employer interviews with 8 different financial services organizations and other employers. And one of the stories that we heard was there's a machine shop not far, a couple of communities away from where we were looking. Machine shop wanted to open another shift, put out a job announcement, started receiving applications. They got 200 applications for those jobs. Awesome. And they notified all the applicants that they'd have to pass a drug test. 100 of those applicants, more or less, withdrew immediately. The remaining 100 that came in for the drug test, 3 out of 4 failed, leaving the company with 25 applicants who hadn't been interviewed yet. Their only qualification other than their resume was that they were able to pass a drug test. 1 out of 8. 7 out of 8 failed or withdrew. That is the opioid crisis. That is something that we did not hear about 5 years ago. I've been doing this at Deloitte for 20 years, and I worked for another company prior to that. This is a new phenomenon. This is the scourge. That is what we're going to hear about in due diligence. When we come to Mississippi and we're speaking to employers in Hattiesburg or Biloxi or Starkville or Oxford, what kind of stories are we going to hear? What kind of incidences are those employers going to report? That's what we need to figure out.
We have a significant shortage of physicians all across the country. We need to promote medical education, including graduate medical education. We also need to recognize that physicians are an economic driver for communities. We are small businesses. We employ local people. We use the local lawyers and accountants and stores, etc. We provide good jobs for people. We provide a lot of jobs, and we're part of the tax base. We're also the infrastructure to bring other industries to town. If you're looking to locate a new company, you want to make sure there's somebody there to take care of your employees if they get sick. So improving the quantity and quality of physicians in Mississippi will be a great economic boon. And we compliment the governor for providing this summit and for the work that he's doing in fostering a new medical school and hopefully new graduate medical education.
Our message is that the development at Tradition in the Gulf Coast of Mississippi has the potential to become a full-blown research cluster like that in North Carolina and the Orlando area of Florida, and particularly focused on diabetes and obesity research and solving both economic development problems and health economic development problems in Mississippi.
What will it take for Mississippi to get to the next level when it comes to health care?
When it comes to healthcare, investments in academics and healthcare in conjunction with research institutes, as well as a focus on increasing the productivity of the population, in particular on diabetes and obesity research.
We really have so much potential to continue to grow this, and I think it's really a big part of it. I think the governor's pointed out, as those of us who are baby boomers start to get older, we're going to need health care, so those are things that are very important. So all those are part of that process, so we will work to make sure that we're continuing to move the momentum, move the needle, and really make health care a focus of what we do as part of our efforts to grow our economy here in the state of Mississippi.
What potential does this offer in terms of jobs?
The hundreds of thousands of jobs. I mean, if you look at 60,000 now just in the hospitals that we have, there'll be another 19,000 jobs added just with a new medical school alone at UMMC in downtown Jackson, the medical corridor. We hope very soon to get into medical manufacturing. We have a very good company now, Baxter, for example, in the Mississippi Delta. And so this is an unlimited potential for Mississippi. Telemedicine, we're one of only 7 states in America that received an A rating from the National Telemedicine Association. Mississippi is leading in expanding access to health care.
It's been a great day. I tell you, some great panelists, some speakers. I mean, when you have the president of the American Medical Association wrap up as your keynote speaker, that's a pretty impressive day, and I really am very excited about how things went.
If people be interested in more information, what should they do?
Go to mec.ms, that's the Mississippi Economic Council's website, or their healthcaresolutions.ms site. All of those will be providing some additional information about what went on today.